cases, they've made multiple attempts to stop. And typically, the reason I think that they fail is because all they do is try to become abstinent. For a small percentage of people with a substance use disorder, that actually works. For most people, they need first of all, a lot of times recognizing the severity and the complexity of a substance use disorder is a big challenge. And it's only after a few failed attempts at stopping on their own do they realize, geez, I can't do this by myself. And so they come to treatment not really sure what they're coming for. At first step, we have a revolving cycle of professionals that come into our treatment program every Thursday. Doctors, nurses, counselors, dietitians. We have another physician that comes in about the and talks about the neurobiology of addiction, which it's interesting. It's one of the best lectures that both family members and patients like, because there's some answers, there's some explanation about why does he do those crazy things, you know, and for the first time families may be hearing about well, because his brain's wired different, you know, or because after using for so long it became, you know, those neural pathways are different, you know, so there's that education that's real helpful. There is the power of being in a group of people that know exactly what you're talking about when you talk about the feelings you have, the sense of being out of control, when you talk about things that you've done when you've been using, when you've been in this relationship with a chemical that you think nobody could possibly understand. You're sitting in a room with 10 people that know exactly what you're talking about. That is a very powerful thing. As people progress and start to get better and start to heal, they become important for new people coming in. That whole message of hope, the idea that as bleak and as black as things look right this minute and as crappy as I feel, I can get better, and I will get better if I do these things, you know.